little over 7 years ago, we started our joint program here at St. Francis. We target on those patients who are having hip and knee pain. So we're doing about 1,400 to 1,500 surgeries each year to relieve these patients of pain and give them back the independence in their life. The program is based on clinical practice guidelines, based on physician's practice, nursing practice, and therapy practice. So it's an integration and a collaboration of lots of types of sciences and practices focused on that patient and their individualized needs. When someone decides to have their joint replaced, it's not just you come to the hospital, you have the surgery, and you go home. It begins weeks before your surgery. You come to what we call Prehab education classes. You get to meet the therapist, the very ones you're going to have. You get to see the type of room that you're going to be admitted to the morning of surgery. And they go through the whole process with you. We find out, what are your needs? What's your house like? Who are you going to be living with? Who are you going to be returning home with? What are you going to have available? What kind of resources once you go home during your healing process? Having a coach go with you through this process is very important. It can be a family member or it can be a friend. And they serve as a cheerleader, someone to keep you on task, to keep you moving towards your goals. When you feel like walking 20 feet, they're going to ask you to do 25 or 30. So it just gives you someone else interested in you and seeing you do well. Patients come to joint camp the morning of surgery after they've completed prehab 2 weeks previously. They come in, they come to their room where they're prepared for surgery in the room that they'll come to post-op. That first day when they get back, we come in there in that evening and say, okay, you've had your surgery, time to get up. So they get up either sitting on the side of the bed or at the chair at the bedside, and they actually do have some therapy, start going through their exercises, getting used to that new joint. The next morning, they have all their therapy in their room. They have physical therapy and occupational therapy. Of course, physical therapy is concentrating on getting up and ambulating, and occupational therapy is concentrating on doing those things like bathing, dressing, combing your hair, putting your shoes on. Those activities start then too. Post-op day 2, we get you in your recliner that has wheels on it and we bring you to the gym. And this is where you start your group therapy. So other people that have gone through the same surgery that you've gone through are going through a therapist standing in front of a classroom, so to speak, and you're going through your exercises. And so on day 3, you come back and we do joint camp as a gym and the gym experience once again. And even you can come back to the gym the day of discharge if you like to for one more go through before you go home. When patients are discharged on that 3rd post-op day, they return home and they're going to get therapy at home, or they go to outpatient therapy depending on what their level of need is. Soon they're going to be starting to do things. They're going to say, gosh, this hip, this knee, it's not limiting me anymore. I feel like I can, walk the block. And they do that. Patients return to work within 6 weeks of having their surgery. So this is, if you want to have joint replacement surgery, get rid of your pain and get back to your life, this is the place to come to have your surgery.